Hello everyone, I am Dr. Shweta Andani, consultant obstetrician and gynecologist at Andani Women and Children Hospital, Narsingi, Manikonda, Hyderabad. So, cervical cancer. It is the second most commonest cancer in women. Cervical cancer is a cancer of the cervix, which is the lower part of the uterus and connecting the upper part of the vagina. Cervical cancer do not show symptoms initially, but as the symptoms progresses, they become very prominent. And many of the symptoms of cervical cancer do not show and they just get unnoticed. So, what are the signs and symptoms of cervical cancer? Cervical cancer signs and symptoms varies like menstrual irregularities like profuse menstrual bleeding, heavy vaginal bleeding, then intermenstrual bleeding or postmenopausal bleeding or bleeding after sexual intercourse. Then there can be foul smelling vaginal discharge or altered vaginal discharge which attribute to cervical cancer. Now there can be blood in stools as well as weight loss, dizziness, fatigue which also attribute to symptoms of cervical cancer. Along with this, there can be abdominal pain, low back pain, pelvic pain which attribute to signs and symptoms of cervical cancer. Now, how do we protect from cervical cancer? We can take HPV vaccine, lifestyle modifications like healthy diet, exercise, no smoking, then appropriately timed pap smear or HPV testing. Most important, discussing concerned symptoms with your doctor. Thank you.